Hi, Avon. I'm Avon Fire Chief Bob Spur, and I'm coming to you with our latest COVID-19 update. As always, I'm joined by.
Kathleen Waldron, health agent for Avon.
Hi, Kathleen. So today is the 14th of August, and it's just before 11 o'clock in the morning. And we've got a couple things to share with you folks. There's new things that come up, and we want to run through them. But as always, let's start with the numbers. So nationally, yesterday we were at 5,224,000 known cases, with 158,000, almost 158,000 fatalities. Massachusetts, we're at 113,500 cases with 8,568 known fatalities. Kathleen, how's Avon?
Locally, we have 80 positive cases cumulative, and currently less than 5 people in isolation, which you can now see on the state numbers every week.
Excellent. So to talk about those state numbers, I think that's a hot topic we want to talk about today. The state's got this new red, yellow, green, unshaded, or white system for how spread is in a community. And Avon is currently in the white category, the unshaded category. But something that I think people need to know, a community like our size, under 4,500, because of the state's formula, can only ever be white or red. It's impossible for Avon, due to the math, to be green or yellow. It doesn't work. The state doesn't begin to report cases until you've had 5, which is an average of 5 cases over a 14-day period. At 5 cases, Avon would be 8.1, 8.2. So we automatically run into that threshold. What those numbers, how they trigger, again, to review it, if you are under 4 cases or under, you're a green community, considered low spread, safe. If you are in the yellow, so between 4 and 8, it's a community with some moderate risk, something's going on there. And if you're above 8, you're a red community, which is a higher risk area for transmission, and the state's doing some selective help to get you in there, whether it's a new enforcement team, they're sending out messaging in multiple languages. There's a whole number of things that they're looking at doing their expanded testing. But what I want people to know real early on is, and we don't see this happening right at the moment, but as late as early June, we possibly could have hit red. We did have, that was our last time we were up. We were in the 30s at one point, but we're down. Hey, we're in great shape. It's going forward. You still need to do all the mask precautions. Don't take it that I'm saying that, but we're in good shape. We're down. But if we go up just to 5, Avon's going to turn red. So don't freak out if you see that. There's, it's a low number for us. Kathleen, what else is going on? I rambled on about that because it's kind of something that I'm a little bit passionate about the math on there for the briefing packets I do. But
Yeah.
what else is going on?
No, I think it's really important. And also, if you could help us out, maybe share this video with someone just to explain it. We want people to understand the numbers before, if we were to turn red.
Right.
We want people to know that, yes, we still need to be concerned, and the activity of spread has increased, but it's a level of concern, but it's not a huge jump like it's going to look like.
Right.
If that makes sense.
And we're not saying there's 95 communities just like us that
Right.
fall into it in the state. So there's 95 of us that only can ever be red or white.
Yeah. So there are a couple updates that Governor Baker has put into effect starting on Tuesday, the 11th. The cap of outdoor gatherings has changed from 100 to 50, and this includes private spaces such as private parties in your backyard. He reiterated the fact that we should try to keep our groups small and practice social distancing. If you do have a gathering of larger group, to wear your mask as much as possible. There's also some information out there that he has changed. This kind of applies to Avon, but you should know it mostly if you're going out to other places. Bars that are masquerading as restaurants. So in order to be open, you need to serve food from a food establishment that needs to be prepared on site. You can't go to a brewery with a food truck. That's not allowed anymore. Also, he postponed indefinitely step 2 of phase 3, which would include some other things such as like laser tag, roller skating, indoor theaters, performances. such like that. The other thing I wanted to talk about was the traveling. I think we touched briefly on the safe states that you can travel to and from without being tested for COVID-19 prior to going there or quarantining when you come back. Rhode Island is no longer a safe state, so if you did have plans to travel to Rhode Island, you would need to test negative prior to going and quarantining when you come back. The safe states are still New York, Vermont, New Hampshire, Maine, Connecticut, and New Jersey. And then one other thing, well, actually two other things I wanted to talk briefly on. I'm sorry if I'm going on, but I think it's important. One thing that's been brought to my attention and Chief Sparrow's attention, it seems that a lot of people are still concerned that COVID-19 is being spread by surfaces. And the CDC has come out and said that the main spread of COVID-19 is still a respiratory disease from person to person, being in close contact for an extended period of time. It's not thought to be passed through surfaces unless you were to touch a surface and immediately touch your eyes, nose, or mouth. With that said too, I've seen a lot of people touching the front of their masks. When you're putting your mask on and off, you want to touch it just from the ears. And when you take it off, you want to sanitize or wash your hands prior to going about any other business. So I think that sums up everything I wanted to discuss. Am I missing something?
Quick comment on the Rhode Island. So especially in Southeastern Mass, we see a ton of Rhode Island workers and a ton of Rhode Island plates. They specifically have a carve out. So if you're a regular worker that's in and out, that's an exemption that the governor gave, basically as an essential workers. And if you're someone, probably not a lot in Avon, but if you're someone who has medical appointments in Rhode Island, they are specifically a carve out that you can go to your medical appointments in Rhode Island and get that taken care of. So, if you're someone that travels back and forth, take a look at what the order actually, in detail says, because it may not be exactly what you think it is right at the moment. And the workers that we see from Rhode Island, they've been with us in state all the time since this pandemic began. It's a travel in and out. So seeing a Rhode Island plate's not an, oh my goodness.
I think to keep in mind is they're discouraging us spending a lot of time in Rhode Island.
Yeah.
Rhode Island has had some issues with people not wearing masks. I know there have been some ongoing problems at Block Island, people traveling, being in close spaces, no social distancing, no masks. So they're discouraging spending a significant amount of time in Rhode Island.
And honestly, when it first came out that we did this, the Rhode Island governor actually embraced it. She said this may be a good opportunity to show people in Rhode Island, look, this is what happens when we do slip. So, Mass, we need to keep up on it. Let's not have the rest of New England say, hey, Mass, you're not the safe state either. We're doing good. Keep your masks on.
Yes.
Okay. Kathleen, anything else for them? I think we've covered a fair bit today.
I think we covered a lot too. Like I said, if you could share this with someone who maybe hasn't seen our updates, I think it would be helpful just to get the information out there.
Excellent. Thank you very much. Folks, have a good day. Stay safe.
Bye.